of pharmaceutical influence. And they did that over about 5 years, and they ended up releasing, I think it was in 2013, I think it came out initially, a series of 16 articles in a law journal. Now, all of these are freely available online. You just have to Google them, and you can access them just by looking at the SAFRA Ethics Lab in the Harvard University Law School, and then just type in pharmaceutical, and you'll see a lot of stuff. But what they did, they got experts in different aspects of life, really. It wasn't just to do with science, but they had experts there, but they also had expert statisticians, they had people who were expert in advertising, in social media use, and all these sort of aspects of our lives. And what they did, they came up with a completely damning conclusion, all supported by irrefutable evidence, that the influence of Big Pharma from the day a medical student walks into the university to the day they graduate, to what happens to them when they go and start working in interns in hospitals, how hospital buying procedures in terms of drug use, etc., are influenced, how medical associations like the AMA are influenced, how groups, social groups are set up on social media looking like, for example, patient groups, then have discussions about different aspects of health and how these groups are basically bought and paid for by Big Pharma, how pharma influences groups like the Friends of Science in Medicine and skeptics groups around the world. And very, very particular for my interest was the extent to which pharma influences research in pharmaceutical medicines. And they showed the degree of corruption in the research process. So anyone who's at all interested in a non-conspiracy-based exposure of pharmaceutical industry, that's the top reference. The other person I would highly recommend to anyone who's interested in this area is a Professor John Ioannidis. I think it's Iaonnidis. Now, he's highly regarded in orthodox medicine, and he's no friend of natural medicine at all, but he really started stirring the pot in 2005, where he published a paper called Why Most Research Findings Are False. Now, this guy's a professor of medicine, but he's also an expert in epidemiology and statistics. And he was showing, once again, how corrupt a lot of the research processes in natural medicine are. So even though they're randomised controlled trials, which we hear ad nauseum is the gold standard of evidence, well, the gold standard is actually a fool's gold standard. It's very, very tarnished in many cases. And, you know, a lot of research now is being done by professional research bodies around the world that often set up in third world countries where governance requirements are very, very lax. And so the findings that they come up with are basically what their sponsor, the drug company, wants. So there's no transparency in the evidence base that we are shown on the nightly news saying, you know, how wonderful all these things are. And by the way, talking about the word transparency, you also can look at Transparency International, which is a global organisation looking at, the truthfulness of public information. They also came out last year with a finding against the pharmaceutical industry internationally. So there's a ton of evidence, but yet our politicians, and particularly health ministers, seem to be blissfully unaware of it all. Well, of course they would be, because they're people who mostly don't know much about health and medicine, and so they have to rely on the information they're given by their bureaucrats. And guess what? That most of their bureaucrats are trained within the pharmaceutical system. So it's a vicious cycle. This is why we need to speak out. This is why the petitions I mentioned are important. It's also why a political initiative is also very, very important. And if we get time, I'd like to mention briefly the Health Australia Party, because at the moment it's the only party which is devoted to trying to preserve the future of natural therapies in Australia and preserve patients' rights to access the form of medicine they want.
Yeah, would you like to talk us through the Health Australia Party now and tell our listeners who haven't heard of it what it's about? Yep.
Yeah, so look, it was formed in a meeting in Melbourne in 2015, and we actually stood Senate candidates in 4 states in the 2000 election. It started and included in that original group people from an earlier political party that was very much New South Wales based, but the Health Australia Party itself is a national party, and we're registered. We've just not long ago gone through our audit by the Australian Electoral Commission. Every party has to go through that every number of years to make sure that they're compliant. So we've passed ours with flying colours, which was nice. We're also now have submitted to the Victorian Electoral Commission an application to become a party registered in Victoria. So you see, even though you're a national party, unless you also register in each state, you can't stand in this different state elections. So we're certainly hoping to run in this year's Victorian state election and certainly next year's federal election. We're talking to people in other states in Australia about trying to get the numbers up, because it's all a numbers game and money. So people, if they just type in Health Australia Party, all one word, .com.au, they'll be able to have a look at our policies to see what we stand for. And even though, natural medicine is really, well, it's the reason I became involved, we don't believe that health in its broadest sense is just to do with medicine. So we talk about a healthy economy, a healthy society, a healthy democracy, a healthy environment, as well as healthy people. All of these things are needed to make a truly healthy community or country, and that's what we're trying to do. We're a very green party in the old sense of the word, not in the new sense of the word, in the sense that we don't believe not only that there should be chemicals sprayed all over the environment, but chemicals put in us unless they're absolutely necessary. And sometimes they are. There are times when a person would be foolish to deny taking an antibiotic, but probably 95% of the time you're foolish if you do. So we're not a party that says you should never use pharmaceutical medicines. We're saying let's use the best of pharmaceutical medicine, and at times it's life-saving. Emergency wards in hospitals are amazing. I'm just blown away by the work that the doctors and nurses do in places like that, and they're absolutely essential. But when it comes to chronic disease, it's a different matter. And the real prevention of chronic illness in our community is a priority. We really, in Australia, as in a lot of Western countries, we have an epidemic of chronic disease. So, the pharmaceutical industry has developed the most perfect business model. It involves reducing infant mortality, increasing the length of life of people in the community, increasing the level of chronic illness in the community. If you do those 3 things, then you're set for life, basically, in terms of selling drugs. And that's exactly what's happened.
Yeah. Can you tell us a little bit about how people can support the Health Australia Party?
Yeah, well, look, at the moment, one of the biggest supports we can get is for people to join as a member. It's only $20 a year. But for those few people out there who really feel that they have the time available and the passion to get more involved here, we certainly are always willing to welcome people who, have a genuine commitment. And I mean a genuine commitment in the sense that we're not looking, once again, for conspiracy theories. We're not trying to unnecessarily set one part of the community against another. We want to be a true centre party where people have choices, genuine choices,
yep,
which have been eroded in this country. But if there are people who really feel a resonance and would like to practically do something, then if they'd like to send an email to me at executive@healthaustraliaparty.com.au, we'd be very happy to talk to them from any state in Australia. We've got a couple of small committees going in other states. Victoria is our most developed state, but we really need to get more work done in other states. And to do that, it's going to totally rely on people who have a genuine interest to try and make that happen. But if you have, please don't hesitate to get in touch, and we'll be very happy to hear from you.
Okay. I will also add that email, if that's okay with you, Isaac, onto the description.
Yes, thank you very much.
Yep,
thank you.
And also in terms, because you say how you're pro-choice at Health Australia Party, and I've done a couple of podcasts on the mandatory vaccination laws that have come through, the no jab, no pay and no jab, no play. Just to clarify, what's Health Australia's party's stance on these?
Yep, good question.
Yep.
So the first thing I want to do is make it very clear we're not anti-vaccination. At the last election, there were the usual suspects came out and said that we were an anti-vaccination party, which was untrue. So we had the AMA again and the Friends of Science and Medicine. Unfortunately, once again, Di Natale from the Greens and a few other like-minded pharmaceutical supporters came out and said that. We support vaccination if that's what people want to do, but we are totally opposed to anything that is coercive. And in fact, if people want to see this, it's on our website. We actually have made a policy statement about the no jab, no pay, no jab, no play legislations, which we unambiguously oppose, making the point that just because you oppose something that actually is not grounded in science, it doesn't make you anti-vaccination. You know, there's a group of doctors, I think they're paediatricians in South Australia, who actually made a comment recently when the South Australian Parliament was looking at what they should do. And this group of doctors pointed out that there is very, very little evidence that unvaccinated children are responsible for diseases in vaccinated children, but yet there is evidence that denying young infants and children the ability to socialise and to learn when they're in their formative years before going to school is actually harmful. And so this group of doctors were actually saying they don't support the no jab, no play being proposed in South Australia. And this should have been the attitude across both the federal and the state governments that have pushed very hard for these bans, because what they're doing something that is not based on evidence. It's not based on hard science. But yet it is causing a great deal of stress in the community. It was interesting. I noticed I don't know if it was the education minister or not, but just recently one government senior official was coming out saying, you know, how important it is that children get an opportunity to have early learning. And yet that is exactly what this legislation is denying, without any real evidence of benefit to the community. You see, the thing is this, that the essential argument that the no jab, no play, no jab, no pay legislations are based on is that, okay, there are some children who can't be vaccinated because they have serious debilitating health conditions, and therefore unvaccinated people will put them at risk. But what they're not acknowledging, apart from the fact that there's hardly any evidence, as the South Australian doctors showed, supporting this. They're also ignoring the fact